Mcis. Welcome again to our forum, which has recently been bi-weekly, but so we will start as always with the current data. Unfortunately, we didn't make it through the whole month of November. In November, we had 3 people who tested positive for coronavirus among the people that we support. One of those people had been vaccinated and 2 were unvaccinated. The 2 who were unvaccinated were a person in a natural home and one in supported living. So by placement type, we have had 9 people in host homes, 114 people in intermediate care facilities, 1 in a mental health facility, 63 in natural homes, 2 in a nursing home, 4 in out-of-state placements, 42 in residential habilitation, and 214 in supported living. So by placement type, this works out to about the 114 people in intermediate care facilities represent about 38% of people in intermediate care facilities who have tested positive for COVID. Of those 114 people, 28 have subsequently died. However, only 13 of those have been confirmed COVID deaths. So what that represents is of the 114 people in ICFs who contracted COVID, a little over 11% of them did die from a confirmed COVID death. In natural homes, the 63 people represent just under 7% of people in natural homes. Of these, 6 people have subsequently died, but only 5 are confirmed COVID deaths, representing about 8% of people who are in natural homes who contracted COVID and then had a confirmed COVID death. In residential habilitation, the 42 people who've contracted COVID represent close to 39% of people in residential habilitation placements who have contracted COVID. Of those, we have had 3 deaths, but 2 have been confirmed COVID deaths. So people who contracted COVID in residential habilitation placements, we've had just a little under 5% of those who have had confirmed COVID deaths. In supported living, the 214 people who have contracted COVID represent about 22% of people in supported living placements. Of those, we have had 26 deaths, but only 15 are confirmed as COVID deaths, which represents of the 214 people in supported living who contracted COVID, about 7% have died. So that overall, for people supported by DDA, the 449 people who have contracted COVID represent a little over 18% of people supported by DDA. We have had 66 of those 449 people have died. However, only 37 of those are confirmed COVID deaths. So of the 449 people who contracted COVID, we've had a little over 8% people who have died. So as I indicated before, the 3 COVID infections in the month of November were 1 person in a residential habilitation placement, 1 person in supported living, and 1 person in a natural home. We have not had a person who has contracted COVID who has required inpatient treatment for COVID since April of 2021. Of the people who have been diagnosed with COVID who have died, the most recent death was 1 death in November. However, as I had indicated, for a total of 66 deaths. However, as I had indicated, there are 37 confirmed COVID deaths, and the last confirmed COVID death was in March of 2021. Among provider staff, we did have an additional result this week. So we've had 741 provider staff. I noticed when I was doing the data that I had missed previously. There have been now 54 staff who have reported working for more than one provider. One had been added in October and one in September that I neglected to add on previous slides. So 54 staff have been reported by more than one provider, and we have had 10 staff deaths from COVID-19. So for people supported by DDA, we're at 80%. In host homes, it's 89%. Intermediate care facilities, 99%. Natural homes, 65%. Residential habilitation is 97%. Just one note, all of the people in residential habilitation who have not been vaccinated are in people who are in residential habilitation placements outside the state, like not by one of our local, not supported by a local provider. And 91% of people in supported living have been vaccinated. Among provider staff, I'm happy to report they are at 94%. And among DDS staff, we are also at 94%. So as it relates to vaccines, just in way of an update, the CDC updated their guidance this week regarding boosters for COVID-19. As we've told people before, you should really, you really do have to monitor the CDC and the coronavirus.dc.gov websites regularly because there are updates. I know I had looked Monday, and then on Tuesday it was updated. So the recommendation now regarding COVID-19 boosters is if you are 18 or older and received a Pfizer or Moderna vaccine at least 6 months ago, then you should get a booster. If you are 18 and older and received a Johnson & Johnson vaccine at least 2 months ago, you should get a booster. They also have included in their recommendations that the booster can be that you can use a different vaccine type for your booster than the one that you received for your original 2 or 1 shot. So if you're scheduling a booster and for some reason you want to switch what kind of booster, or the availability suggests it would be easier to get one of the others, the CDC has indicated that they allow for the mix and match of booster with the initial vaccine. Given this update, we are updating Mcis. We'll send out a transmittal as soon as that's done so that people will be able to upload the vaccine booster to Mcis. They'll be able to upload the evidence of that. We will be tracking that along with, there'll be a tickler to identify which people are due for a booster, and then we'll be tracking who has gotten the booster. And we'll be sending out our transmittal with guidance about that as soon as the changes are made and tested to make sure they're working in Mcis, but very shortly that will be going out. Nelson just shared, and it's very helpful because, so for questions going forward concerning vaccines, the immunization team requests that you send those questions to covid-19.vaccine@dc.gov. One other update based on questions we've gotten in the past and of interest, I'm certain, to our provider community. Our provider certification review contract, as people may be aware, a solicitation was issued a number of months ago. A new contract has been awarded. Clarent is the new provider. It's QLAR. Isn't that funny? I know QL, and then I don't know if it's ENT or ANT. I think ENT. So Clarent is the new provider. We do have an extension with Liberty for the next 2 months. Both Liberty and Clarent are on board right now so that we can effect a smooth transition from one provider to the other. Thank you very much. It's QLARANT. And so people who were scheduled for a provider certification review with Liberty this month will still get that, and the full transition will be occurring by February, when Clarent will exclusively be conducting those reviews. And that name is in the chat. We received a question by email this morning. And just as a reminder, it would be helpful, and I believe we send this reminder out when we send out the invitation for the meeting, but if people can get us their questions early enough by Wednesday, that way we can invite people who may be needed to respond to those questions if we recognize that it's one we're not able to respond to. So there's a question about has DC Health now issued all of its exemption decisions regarding vaccine exemptions? If not, when will they be completed? And also, if not, what percentage of those who submitted requests remain open? So on Monday, my understanding is that there was a long-term care administrators meeting that they invited a representative from DC Health to. And the report at that time was that they have reviewed and ruled on about 50% of the requests for exemptions. Please be patient. They are getting through them as fast as they can. As a reminder, people can put in questions. If you do, please make the question to everyone, and you have to scroll down to the bottom to get to everyone so that we can read your question and respond to it. So there's a question, what percentage of the exemption requests were granted? I don't know if they responded to that on Monday or not. If there's someone here who was at that meeting, I just got the answer to those questions from the meeting, but I don't know. And if there's anyone on the panel who knows, feel free to answer that question, please. We'll ask DC Health if they have that answer so that we can respond next week. Do we anticipate boosters being part of a next step vaccination mandate?
I can answer that, Director Reese. In order for that to happen, the CDC would need to change their definition of what fully vaccinated is, and at this time, the CDC has not changed that definition.
I will remind people, however, the recommendation from the CDC at this time is if you were fully vaccinated with Pfizer or Moderna 6 months ago or more, you should get a booster. So while there may not be a mandate, in the interest of keeping us all healthy, people should really be looking toward getting boosters. And just so that people are aware, you should also go to vaccinate.dc.gov. There really is wide availability of booster vaccines, of vaccine. You can get the vaccine. There are walk-in clinics for the vaccine right now. You can schedule an appointment and go in. They are free and available. So either go to coronavirus.dc.gov or vaccinate.dc.gov. It's a little early to be saying this, but since there aren't any questions right this minute, just as a heads up to people, we won't be having calls on December 24th or December 31st because both of those are the holidays observed. So our office will be closed on those 2 Fridays at the end of this month. Are there any updates on the rollout of Station MD? Can I defer to, I'm looking down my list. Oh, to Crystal or Jared to respond to this. I'm not aware of an update. I mean, as soon as there is one, we'll send it out, but I'm not aware of a specific rollout date.
Hi, Andy. This is Jared. We do not have that specific rollout date at this time. We are still working on a few things internally and hope to provide that date before the holidays so that people are aware, but we do not have the date right now.
So the next question is, will the PCR team change or is it just the contracting company? That is a decision for the contracting company. As they do their transition and hire their staff, they'll be making decisions about who's on their team. So when contracts are considered, they wouldn't have the whole team in place because the solicitation and their proposal is submitted months ago. So down to the level of PCR reviewers, those are decisions that will be made as they come on board at the beginning of February. So if the record keeping for vaccinated staff are in percentages of people vaccinated and there's no record of percentage of exemptions, will that not affect the list of compliance? So the list reflects the percentage of people vaccinated. It doesn't reflect compliance. Compliance monitoring will be done and will continue to be done, as I said, by provider certification review. And so when they go to a provider's location, they will want to see the evidence that the provider has that their staff has been vaccinated or has sought and has pending or been granted an exemption. And so that's on an individual basis. It's not something that we're reporting on. What's the date for the rollout for the new MCIS? Jared, is that January still?
Yes, still scheduled for January 1st. We are, and hi, Jachelle, long time no talk. We are establishing dates that we can host meetings, both internal to DDS as well as with our external stakeholders who work in MCIS to further the discussions on that. I know we had previous kind of rollout demonstrations of the system. We're looking to schedule those again between now and the end of this month so that, again, we're going live on January 1st.
So the next question, it says for Nelson. Can you share the link that refers to the requirement that people quarantine for 2 weeks after exposure, even if they test negative? So I know that that is in the coronavirus.dc.gov website. Ah, and there is the link. So for people who are on the phone and can't see the chat, I'm not going to read out that that whole link, but I will just tell you that you can go to coronavirus.dc.gov under health guidance, scroll down to resources for the public, and under health guidance, it's entitled guidance for, oh, right, close contacts of a person confirmed to have COVID-19, quarantine and testing, November 29, 2021. There's a request that new MCIS training dates get established quickly and sent to providers. December is a short month due to the holiday. We want to ensure that staff are trained and prepared to work in the new system. my impression, Jared, correct me if I'm wrong, is that training's been ongoing for quite some time.
Yeah. Sort of two things about that, and we are making, all efforts to make the trainings available as quickly as possible, understanding, the shortness of December. Kind of two things about it from what I've seen and the changes to MCIS is that they're very minimal, that, it may look different in terms of the coloring of screens and font and so forth, that this will not be something that will require a strong kind of learning curve. So that's kind of the first part of that. There are deletions and a few additions that will certainly point out as the significant changes, but this should not be something that people are fearful of a huge change in how the system will function, even if, like I said, some of the looks of it are a bit different.
Because the most significant change is really the platform on which it operates, right?
Right. Which has nothing to do with sort of what a user will need to know about as they're going through it. I mean, everything from your sign in credentialing is the same. So yes,
Just a little
it's more
prettier.
correct. But the format, the tabs, all of that really looks the same.
So if we have no more questions, we could just stop at 12:35. That usually spurs a question or two. Our organization is a new provider approved in January 2021, have done new provider training, attended providers meetings. We aren't yet getting referrals regarding service provision. So people have choice of provider, and I don't know what kind of service you provide, but in the past, and it's been a little while because we used to do these in person, we would have provider fairs so that providers could make people aware of their services. In terms of residential providers, quite frankly, we have an issue currently with a number of vacancies. So we would rather certainly see vacancies used first to the extent they can be. And so that's not going to be a new provider. The residential support aspect may be one of the harder ones to break into as a new service. I also think it's really important to be thinking about sort of, where there's the need for services in our system, in terms of the, in residential supports, what we've seen is a significant shift, or it seems to me a pretty significant shift, that we have a lot more younger people. We have many more people who require behavioral supports. And so providers who are better equipped to deal with that are probably in a better place to get referrals. I think it can be challenging for new providers to break in because as people are choosing, people go with what they know. And so, it's, I'm not sure how to advise people about how you do marketing for your program. Can you let us know the procedures for getting prior authorizations for persons we no longer have access to on MCIS or have gaps when billing for a retainer payment? I thought people should have access to anyone if if hmm. Uh, didn't we provide a contact on the transmittal that people can reach out to when they have questions about retainer payments? Because I would just say for that individual question, because fortunately I'm not hearing that a lot, if you could reach out to the contact that's identified on the transmittal and ask them how to do that. Because we do not have prior authorizations in place for the retainer payments. The only issue was to make sure that it had been authorized previously. We were not going to go in and issue new authorizations for the retainer period because it would have been hundreds of authorizations that needed to be done before people could submit those claims. But please look at the transmittal that went out, and at the bottom of that, it's identified the contact information for questions. If a staff person doesn't show up for work and they went to the emergency room because they had to go due to symptoms they had, provider called and couldn't get in touch with them, they may have been hospitalized, didn't have their phone to answer. When they come back, what is the date to put on the incident? Well, it seems to me if the person didn't show up to work on Friday and you don't see them until the next Tuesday, the date that an incident occurred would be the date that you were understaffed. So if right, I mean it's the date that the staff person going to the emergency room or being hospitalized, as much as you'll be concerned about your employee, is not the incident that gets entered. The incident that gets entered is that the person you support is supposed to have a particular staffing ratio, and if that ratio is not being met, that would be entered as the incident. Could IT make MCIS more functional on mobile devices? I don't know the answer to that question. And I mean, I'm pretty sure Beam's not here, and I mean, I know it's yeah, you're talking about on a telephone because our tablets are essentially mobile devices. Um, we can ask Beam about. So the issue is you can view everything from a mobile device only for the current person selected when you first log in, but you can't select another person, which suggests to me you have to log out and back in again. But we'll ask Beam that question and respond next week. I have a question regarding masks for ICF day habilitation. Is it possible for us to make provisions, possibly with nurses, for staff to assist with putting on and taking off masks? This could remove barriers that are preventing some ICF participants from attending day programs. I should probably defer to DC Health on this. I will say my immediate response is absolutely not. I believe the guidance is if you are unable to independently remove a mask, you should not have a mask on.
That's absolutely correct, Director Reese. The reason for the CDC's recommendation that those persons that cannot independently remove their mask not wear one is because it's not really an issue of getting the mask on. Anybody can help them put a mask on. But if at some point it becomes difficult for them to breathe, there may be those that may not be able to indicate that they're having difficulty breathing and ask for the mask to be removed, for example. And so there would be no way for a nurse or anybody else who was there to help remove a mask to know that the mask needed to be removed, and it becomes a serious safety concern. And so that is the reason for that recommendation. So I am in agreement with Director Reese.
Thank you. So what is the requirement for asking the vaccination status for people coming into the home? Since the mandate for healthcare providers needing to be vaccinated since September 30th, I've heard different things, and some of our family members don't want a loved one served by someone not vaccinated. This isn't going to be a helpful answer, perhaps. Here's the challenge in that regard. I think it's perfectly reasonable to want to know before you let someone in your home whether they've been vaccinated. On the other side of that, one of the reasons that a person may not be vaccinated is that that person may have some health condition that prevents them from being able to get a vaccination. And disclosing that they're not vaccinated sort of moves them toward the issue of disclosing their health information, which is protected. And so that becomes a challenge. I sort of think what's more, for one, I think it's a great conversation for people to be having, because as I say as often as I can, all of us who can get vaccinated should be vaccinated. And based on current CDC guidance, that means when you're eligible, a booster as well. But there may be people who, for some sincerely held religious belief, which I don't know that that is protected in terms of, that's not like protected health information, or because they have some health issue, which is a pretty limited scope of people, quite frankly, may not be able to get vaccinated. And in those instances, there were steps that could be taken before there was a vaccine to protect people. And so saying, well, if you're not vaccinated, here's what I need to see in terms of PPE. So it is challenging. I do know that programs can require that people get a vaccination as a condition of participation. However, that's going to push up against a person's, it's going to push up against potentially the ADA, as well as, because if a person can't get the vaccine for a health reason, then, you can't exclude them. And it's also going to push up against people's sincerely held religious beliefs, because, they may also, and so then you have to figure out how you navigate that aspect of it. And that's, sorry, I'm not really answering your question, because before someone came into my home, I would kind of want to know that question as well. But in the alternative, I just put on a mask while they're there. So any questions that people have after reviewing the most recent transmittal regarding retainer payments, please email pamela.harmon@dc.gov. So someone is saying, a person can say they are exempt and they're dealing with this, And especially now with all the variants for contact tracing, it is very complicated. And honestly, I don't know, from my perspective, and this is maybe me as a social worker, I think it's a very good opening for a good conversation too. Because you're talking about people who don't want folks in their home, which suggests natural homes to me, which is honestly where we really still have the heaviest lift about getting to a point where we have a comfortable percentage of people who've been vaccinated. 65%. That is not good. And that's just the initial vaccination, much less getting a booster. And so I really appreciate, and as I look at the slides, I really appreciate our families who are concerned about allowing someone in their home. And the reality is, while it is true that the vaccination rate for people in natural homes is at 65%, which is lowest, the infection rate for people in natural homes is just under 7%. So, our families who we're still working with them to encourage everyone to get vaccinated have done a very good job of keeping the people that we support who are living in their home safe. There are other steps they can be taking, and we really want to see them take those steps because especially apparently this new variant is even more contagious than the more recent Delta variant. So yeah, and also someone saying they're exempt, that means nothing about how easily, well, it means a lot. It means they could transmit coronavirus to you. Um, the thing in the district government where people are required to get vaccinated, there is the option for people to test weekly rather than get vaccinated for some people. And so, the other option is making sure and reassuring the person, even for our staff who, for whatever reason, have not been vaccinated, they do use this PPE and whatever the testing requirements are of your particular agency. There's not a testing requirement in the vaccine mandate, but agencies are free to have a testing requirement in the same way the district government has a testing requirement for its staff. Could DDS ask providers what testing requirements they have put in place and share that information with the community? We'll consider this. I'm hesitating because each of these questions feels easy, but it is, it's easy for me to agree. It is an additional burden for the people who have to collect the information, compile the information, for all the providers who have to respond to yet another request. And I know that each and every one of them is important and feels like it's just one question, but it is another whole undertaking. But we will look into whether that's something we can do. So the last time, Carol, you said your question was for Nelson. I will say it's for Nelson now. So Nelson, it appears that the quarantine guidance was just updated. In what ways was it updated, and why is supported living still included even though apartment buildings are explicitly not considered health facilities?
What I can say is the updates did not at all affect these settings. Most of the updates were related to schools and quarantine for schools. And I can't speak to why nothing changed as far as quarantine for supported living facilities. The decision was made to keep that the same for this revision. And as I've shared before, there are ever ongoing discussions about that particular aspect of the guidance, and should updates be made, everyone will be notified in this forum, and it will be indicated in the guidance.
Thank you. Okay, it appears now that we have no additional questions. Ah. Why is it that DSPs working in host homes don't qualify for the bonus? You know, there was a lot. All I can say is, so I expect the bonuses that you're referring to are the DSP bonuses that were included in our Appendix K, that were included in DHCF's FY21 budget. They were able to allocate 1.4 million in local funds, and they were able to do it through the waiver so that we could capture federal match for it. And based on the amount that was available then, and in coordination with the provider coalition and working together over a long period of time to come up with a way that seemed best to allocate all of those funds, they came up with the allocation that they did in terms of provision of those funds. So, you know, it was a long process that I believe DHCF worked hard to make sure it was inclusive in developing how those funds would be distributed. And then just to note, there'll be a second round of those as soon as we get access to our ARPA funding. There were funds put in for a second year of those bonuses for waiver providers through DDS's budget. So there's another question about which DSPs were included in the bonus. I would have to get with DHCF to provide a more thorough response about how the decisions were made about amounts that were included in the bonus. Why is it that nurses and managers don't qualify for the bonus? That one I can answer. The bonuses were established in an attempt to at least make some progress in response to the DSP Wage Act, which called for increased wages for DSPs. And so it was about addressing DSP workforce issues, and that's the reason that nurses and managers would not have been included. It is now 1 o'clock. And so if there's more questions, please send them in by Wednesday and we'll be well prepared to answer them. Everyone have a good weekend. I'm told, I'm looking out the window and don't necessarily believe this is true. I'm told it's beautiful outside. I guess it feels beautiful outside because it doesn't look beautiful outside, but people tell me it feels really nice. So hopefully people can go outside, enjoy what I'm told is very nice weather right now, and that you will all have a very good weekend, and we will talk again next week.